Hello everyone. Welcome to my YouTube channel. My name is Anjogo, a PhD student specializing in maternal child health nursing. Today we'll continue with our mini series on fundamental of pregnancy. In fact, this is our last series on this lecture 1. And topic for today is TPAL system with example. Also, we'll discuss on importance of understanding TPAL system in prenatal care. What is a TPAL system? Is an acronym that presents a woman's obstetric history. Let's take a close look at TPAL. G stands for gravida, which is the total number of pregnancies, including the current one, regardless of outcomes. Then we should know that multiple gestation is regarded as one pregnancy. Then the T stands for term births, which is the number of pregnancies carried to that 7+ weeks. And P stands for preterm births, which is the number of births between 20 and 37 weeks. Then A stands for abortions, which is the number of pregnancies that resulted in spontaneous or elective termination before 20 weeks. We should note that delivery of dead fetus after 20 weeks LMP is known as stillbirth, which can be counted as T or P. T is when a dead fetus is delivered at that 7+ weeks. And P is when a dead fetus is delivered between 20 to that 7 weeks. L means living. These are total of live infant born. And then we should note that where multiple gestation are, the infant are counted individually. For example, if it's a twin pregnancy, L is calculated as 2, and triplet births, the L is calculated as 3. Let's look at GPA system. This is a node system was used before TPAL system, before it came into place, where G means gravida, just as same as TPAL system, which is the total number of pregnancies, including the current one, regardless of outcomes. In this system, multiple gestation is regarded as one pregnancy. Where there's a big difference is P. P is para in GPA system and not preterm. Para means a total number of pregnancies that a woman has carried to a point of viability, that is 20 to 34 weeks. And A is same as GTPL system, where it means abortion is the total number of pregnancies that resulted in spontaneous or elective termination before 20 weeks. Let's look at examples. A 32-year-old female is pregnant for that time. During obstetric history, she mentioned that she had had an abortion at 10 weeks pregnant gestation, and she has had a boy born at 38 weeks gestation, and another boy at 33 weeks. Using GTPAL/GPA system, she would be, this her third pregnancy, so she's G3, and she has carried one pregnancy to term, that is 8 weeks gestation, and a preterm pregnancy at 33 weeks, and she has had one abortion at 10th weeks gestation, and she has 2 boys which were born at 38 weeks gestation and another boy at 33 weeks gestation. So she is a G3, T1, P1, A1, L2. And GPA system, she's G3 and P2 because she has carried 2 pregnancy to a point of viability, and she has had 1 abortion. So she's G3, P2, and A1. Sarah is 10 weeks pregnant and had twins born at 34 weeks. She also reported having 2 miscarriages between 10th and 14th weeks. Using GTPAL/GPA system, she would be, she's currently pregnant. This is her first one pregnancy. she has had twins. That's second pregnancy and the 2 abortions. So she's G4 and she has carried no pregnancy to term, and she has had 1 preterm pregnancy at 34 weeks, and she has had 2 abortions between 10 and 14 weeks, and she has 2 babies which were as a result of twin pregnancy at 34 weeks. So she's G4, T0, P1, A2, L2. And then she's a G4 for pregnancy. She's on her 4th pregnancy. She has carried 1 pregnancy to the point of viability, and she has had 2 abortions. So she's G4, P1, A2. Another example is Mary is on her 4th pregnancy. She also reported having delivered 1 live singleton at 39 weeks, 1 singleton at 35 weeks, and 1 set of twins at 35 weeks. Using TPAL/GPA system should be, she's on her 4th pregnancy, so it's G4. She's carried 1 pregnancy to term, 39 weeks, and preterm she has had 2 preterm births at 35 weeks, and then she had had no abortion, and she has 4 live babies who are born like this, that's 9 weeks, then 35 weeks, and this twins at 35 weeks. So she's a G4, T1, P2, A0, and L4. And then she's a G4 and 3 pregnancies. She has carried to a point of viability, and she has had no abortion. So in GPA systems, she's G4, P3, and A0. Another example, Joy is a 33-year-old female who is pregnant for the first time. Using TPAL/GPA system, she would be G1, T0, P0, A0, LO, and G1, P0, and A0. And what if she gives birth at 39 weeks? So she'll be a G1, T1, P0, A0, and L1. And for GPA system should be a G1 and P1 and A0. Let's look at the importance of understanding GTPAL system in prenatal care. The first one is knowing the number of pregnancies can help the healthcare providers determine a woman's risk of certain complications. For example, a woman with multiple pregnancies may be at risk for gestation, diabetes, preterm labor, or preeclampsia. Then the second point is having a multiple term births is a good sign for future pregnancies. However, it should be noted that every pregnancy is unique, and previous terms does not guarantee a healthy outcome in future pregnancy. The third importance is that preterm births can be a concern for future pregnancies, as they are associated with an increased risk for complications such as jaundice, RDS, respiratory distress syndrome, and jaundice. And then the fourth one is knowing the number of pregnancy loss can help healthcare providers assess women's risk for complications such as cervical insufficiency or uterine scarring. We will start on a new series in the next video. Thank you for watching, and see you in the next one.